Clinical applications of pharmacokinetics optimizing drug therapy for better patient outcomes. Welcome to PharmaconHealth. In today's video, we explore the clinical applications of ADME absorption, distribution, metabolism, and excretion. These four pharmacokinetic principles are the foundation of how drugs behave in the body. In this episode, we'll show how each of these processes helps guide effective, safe, and personalized treatment in real-world clinical settings. Let's preview what we'll cover. We'll discuss how doses are adjusted in special populations, the role of therapeutic drug monitoring, drug interactions, the importance of personalized medicine based on metabolism, innovations in formulation and delivery, and how all of this translates into smarter pharmacotherapy. Let's begin with dose adjustment. Dose adjustment in special populations. To start, let us explore how ADME helps guide dose adjustment in vulnerable populations. In renal impairment, the excretion phase of ADME is affected. Drugs can build up if the kidneys are not clearing them properly. We use creatinine clearance or estimated GFR to adjust the dose accordingly. In hepatic impairment, the metabolism phase is compromised. The Child-Pugh score helps us assess liver function and guide dose modifications. Elderly patients often have reduced kidney and liver function. They also have changes in body composition. These factors impact both distribution and clearance. In children, enzyme systems are immature and still developing. Differences in water and fat content also change how drugs are distributed. Each of these cases shows how understanding ADME allows for safer and more accurate dosing. Now let us move to therapeutic drug monitoring. Therapeutic drug monitoring, or TDM, is a real-world way to apply all the phases of ADME, that is, absorption, distribution, metabolism, and elimination. It's especially important for drugs with a narrow therapeutic window, like phenytoin or digoxin. For these drugs, we need to keep the drug levels in the blood within a very specific range. TDM helps by measuring the highest and lowest concentrations, known as the peak and trough, and King the steady state level. This gives us a clear picture of how the drug is behaving in the body. By doing this, we can adjust the dose to make sure the treatment works well without causing harm. Now, let's look at how other drugs or even food can affect how a drug is absorbed, distributed, metabolized, or eliminated. Drug-drug and drug-food interactions can change how a drug moves through the body. Let's break it down. Some substances, called enzyme inducers, like rifampin, speed up metabolism. This can lower the amount of drug in the body. Others, called enzyme inhibitors, like ketoconazole, slow down metabolism. That can lead to higher drug levels and increase the risk of side effects or toxicity. There are also transporters, like P-glycoprotein, that affect absorption and distribution. They can pump drugs out of cells, which might reduce how well the drug works. Food can also play a role. It might bind to a drug, change stomach pH, or even block absorption by forming complexes. Knowing about these interactions helps avoid unexpected or harmful effects. Up next, how genetics can guide personalized therapy. Personalized medicine uses pharmacogenetics to guide treatment, especially during the metabolism phase of ADME. Some people have genetic differences, called polymorphisms, in liver enzymes like CYP to D6 and CYP to C19. These differences affect how quickly or slowly they break down certain drugs. Take codeine, for example. It needs to be converted into morphine by the CYP to D6 enzyme. If someone is a poor metabolizer, they get little or no pain relief, but if they're an ultra-rapid metabolizer, they might produce too much morphine, risking overdose. Another case is warfarin. Its metabolism is influenced by CYP to C9 and VK or C1. Variations in these genes affect both how the drug is processed and how sensitive the body is to it. By understanding a patient's genetic makeup, we can choose the right drug and dose, making treatment safer and more effective. Next, let's explore how drug formulation and delivery methods impact ADME. The way a drug is formulated plays a big role in how it's absorbed and distributed in the body. For example, extended release or controlled release forms slow down absorption. This helps keep drug levels in the blood more stable over time. Some Advanced delivery systems are designed to release the drug at specific sites in the body. They might use pH, enzymes, or even nanoparticles to do this. The goal is to boost the drug's effect where it's needed and reduce side effects elsewhere. These innovations affect how much of the drug is absorbed, how long it stays active, and where it travels in the body. Now, let's bring all of this together for a full picture of admin action. Clinical implications *. Understanding ADME helps clinicians make smarter, more personalized treatment decisions. By knowing how a drug is absorbed, distributed, metabolized, and excreted, they can choose the right dose, avoid harmful drug interactions, simplify treatment plans to improve patient adherence, and reduce the risk of side effects. This is especially important when a patient is taking multiple medications, a situation known as polypharmacy, where drugs may compete for the same pathways. Now, let's wrap up with a quick summary of what we've learned. Let's recap. Absorption tells us how fast and how much of the drug enters the body. Distribution shows where the drug goes once it's in the bloodstream. Metabolism explains how the drug is changed and how long it stays active. Excretion is how the drug leaves the body and helps determine how often it needs to be given. Together, these 4 phases guide safe, effective, and personalized drug therapy. Thank you for joining us on this journey through the clinical applications of ADM. Keep learning with PharmaconHealth, where science meets smarter patient care. Don't forget to subscribe for more videos on pharmacology and personalized medicine.